The OCTA research group warns of possible repercussions once the country reaches its testing capacity. As cases rise further, the group says we might not be able to track infections fast enough. Airlines are appealing for a shorter quarantine period for their personnel as staff shortage limit flight operations. The Philippine General Hospital is likewise understaffed, forcing them to accept only COVID-19 admissions and emergency cases for the time being. And despite record high cases, the Metro Manila Council sees no need for the region to shift to a stricter Alert Level 4 status. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Shawn Yao. The OCTA Research Group is warning of challenges in COVID-19 monitoring once daily infections go beyond the country's testing capacity. Marian Enriquez with the report.
New COVID-19 cases and positivity rates on Monday hit record high anew. In Metro Manila alone, 52% of tests turn out positive. Guido David of OCTA Research warns of repercussions once it reaches 60%.
Pag nagkaroon ng surge dito sa NCR, ang nangyayari kasi syempre, since our local borders are not that tight, yung mga cases, like residents from NCR mag-travel to other provinces, madadala nila doon.
David said that the situation will get worse if cases go beyond the testing capacity.
Kunyari, 50,000 capacity natin. Umabot na tayo ng 50,000. Then, nag-increase pa siya to 100,000. Hindi natin makikita yung 100,000 na yun. We don't know if it's 100,000. We don't know if it's 200,000. We don't know it's 300,000.
Testing czar Vince Dizon said the country has around 80,000 daily testing capacity, but delays continue to hound the government's COVID-19 monitoring.
Kaya humihingi po tayo ng pasensya sa ating mga kayan. Marami po sa ating mga technician, mga medtech, mga laboratory technician ay nagpo-positibo din po.
That's why some experts are recommending the use of antigen tests at home.
We need to have a close coordination with the healthcare professional para lang we should be guided on how to use it and what to do after being tested.
But if one is already experiencing symptoms, there's no need to wait for test results. For News 5, Marian Enriquez, we are One News.
More healthcare workers in the Philippine General Hospital have likewise contracted COVID-19. PGH spokesperson Dr. Jonas Del Rosario told One Balita Pilipinas that some 400 medical workers were infected in the last week alone. Del Rosario said they had to close off some areas of the hospital because of the lack in personnel.
Doon po sa 400, either asymptomatic or mildly symptomatic po. So, either sa bahay po nagpapagaling or minsan po ay ina-admit namin sa aming sariling hospital dahil wala po silang kakayahan na mag-isolate. Pero
Del Rosario added that they are having a hard time tapping additional manpower to replace those that have been infected. Because of this, the PGH will be accepting only COVID-19 and emergency cases.
The other obvious solution is to close down many of our services. No? Babalik kami sa surge mode na primarily COVID referral center ng PGH at yung mga emergency cases lang ang aming i-administer.
Metro Manila mayors have agreed not to elevate the region to the stricter Alert Level 4 status despite the rise in cases. MMDA Chairman Ben-Hur Abalos says hospital utilization rates are still manageable and the positivity rate has slowed down in the NCR. However, Abalos is still reminding the public to limit their travels as much as possible. Meanwhile, the Metro Manila Council has not discussed the need to reimpose the use of face shields, at least for now.
Kung titignan mo naman, pinakita nga namin yung mobility on their own, nakita mo na Friday, Saturday, Sunday, ultimo ang mga tao nagsiself-regulate na.
Airlines are now appealing for a shorter quarantine period for flight crew members as the aviation sector faces shortage in manpower. Gerard de la Peña with the story.
Passengers are piled at the departure area of the NAIA Terminal 2. This is after flag carrier Philippine Airlines canceled more than 20 flights on Monday. PAL said this is due to the shortage of flight crew after a number of employees tested positive for COVID-19. PAL said many others had to go on quarantine after being exposed to infected colleagues. Cebu Pacific, meanwhile, made an announcement as early as last week that it will also cancel flights scheduled Monday. Cebu Pacific says it's working to minimize the impact on passengers.
The operational challenges continue. Remember, we just came from Odette, diba? When we had to cancel many flights. At the last count, 55 passengers were affected dun sa Odette. Now, ito, kagabi, I checked, 200 flights are canceled and more than 22,000 passengers are affected because of what's happening with the recent rise in cases. And we had to manage the operational aspect of the airline. So, ganito yung sitwasyon namin ngayon. But we are working nonstop to minimize the impact on passengers and crew. That's why maaga kami nag-a-announce ng cancellation. We don't want last-minute cancellation.
AirAsia said their flights will operate as scheduled. Employees who had to go on forced leave during the height of lockdowns were able to take over from those who called in sick.
Yung mga pilot and cabin crew, kung sino yung nasa isang cluster, sila lang din yung magkakasama dun sa operations para nang sa ganun, sakaling magkaroon ng hawaan or magkaroon ng problema na kakailanganin quarantine, madali rin silang ma-detect kasi isang cluster lang din sila.
To address staff problems, airlines are requesting for the Transportation Department to allow a shorter quarantine period for flight crew. They are proposing to cut the quarantine to 5 days if the person has no symptoms. Airlines said this should be done to ensure continuous flights, especially those catering to OFWs and the transport of medical supplies to various parts of the country. Transportation Secretary Arthur Tugade said the proposal will be tackled in the IATF meeting on Thursday. For News 5, Gerard de la Peña, we are One News.
Returning overseas Filipinos are complaining of being stuck in quarantine facilities as they wait for their COVID test results. Marty Bautista with the details.
Many overseas Filipino workers who return to the Philippines to spend time with their families are still stuck in their quarantine facilities. Most of them are waiting for the results of their RT-PCR tests amid the surge in cases. Among them is Larry Rose, who arrived from Saudi Arabia last January 4. But what was supposed to be a short trip eventually extended due to the delays in RT-PCR test results.
Nag-swab kami last January 8. Pinangunahan na nila kami na, Ma'am, Sir, asahan niyo na po yung delayed ng resulta. Kung nasabi po noon na 2 to 3 days, may resulta na. Ngayon, hindi. 5 days. Pinaka-maximum.
Some returning Filipinos who are not OFWs, meanwhile, are experiencing trouble coordinating with the Bureau of Quarantine. Ange Valero and her boyfriend who came from Canada are still stuck in their quarantine hotel. Ange tested positive for COVID-19, but her boyfriend tested negative despite being together for 24 hours. With this, Ange is asking for another swab test from a different lab, but the BOQ did not reply to her request.
Until now, walang tumatawag na BOQ. It's been 48 hours since lumabas yung result namin. And our bill is piling up right now.
With no update at all, Ange decided to seek help from her LGU in Taguig City, which was willing to fetch them and drop them off in their condominium where they will continue their quarantine. However, the hotel refused to let them leave as they still need a clearance from the BOQ. Don Sastrillo's fiancé also faces the same dilemma. Her South Korean fiancé has been stuck in quarantine since December 31 after initially testing positive for the virus. But after undergoing another swab test, the results came back negative, which the Bureau disregarded. The BOQ had also ordered hotel facilities to prohibit any re-swabbing on COVID-positive guests to avoid confusion. They are now asking why the BOQ only accredited 3 RT-PCR laboratories, namely Red Cross, Detoxicare, and Philippine Airport Diagnostic Labs.
Bakit meron ba kayong ginagawa dyan na different from what the normal labs do dun sa RT-PCR? Kasi until now, he's fine. Wala siyang symptoms and then lumabas na nga na negative siya.
BOQ Deputy Director Roberto Salvador Jr. also admits that they were surprised by the sudden surge in cases among returning Filipinos.
Since December 26 po, nagulat tayo sa taas po ng positivity rate ng mga dumating po ng mga Pilipino. Approximately po, since December 26, close to 200 ang nagpa-positive per day.
Salvador adds that there has been a shortage in quarantine facilities, which the government is currently working on. For News 5, Marty Bautista, We Are One News.
Let's now take a quick look at today's other top stories. The Pfizer vaccines for kids aged 11 and below are expected to arrive by the end of this month. The government had to make a separate order for the age group, one that contains lower concentrations as compared to Pfizer vaccines being administered to adults. The Food and Drug Administration approved Pfizer shots for children aged 5 to 11 last month. Another round of oil price hikes will take place tomorrow, January 11. Diesel prices are expected to go up by 1 peso and 10 centavos, while a 75 centavo per liter price hike is expected for gasoline. Kerosene prices will also be up by 90 centavos a liter. Actor comedian Bob Saget was found dead in a hotel room in Orlando, Florida. He was 65. Responders said they found no signs of foul play or drug use. Saget was best known for his role as the widow Danny Tanner on American sitcom Full House, which ran from 1987 to 1995. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I am Sean Yao. We are One News.